Hello and welcome everyone to today's webinar, Identity on a Mobile Device, Healthcare, Banking, and Transportation Payment Use Cases. My name is Randy Vanderhoof. I'm the Executive Director of the Secure Technology Alliance, and I'll be serving as today's moderator. This webinar is being brought to you by the Secure Technology Alliance and by the Identity Council, and we thank you for your participation today. A couple of quick notes before we begin. The webinar is being recorded, and attendees will receive a follow-up email after the webinar, which will include a link to be able to access the recording and the presentation. We invite you and encourage you to share that link and information to your work colleagues and associates so that others who didn't get an opportunity to participate today will have an opportunity to hear and view the presentation that you're about to participate in. Also, GoToWebinar has a question submission feature on the webinar presentation page, and we encourage you to submit your questions during the webinar so that we can organize them in advance before we get started on the Q&A at the end. The more opportunity we have to receive your questions in advance and assort them for the appropriate speaker, the more questions we can get to during the session. If we can move to the next slide, please. So allow me to make a short introduction of our guest presenters. Following me today will be Tom Lockwood, who is the Senior Associate of Business Development at NextgenID and an experienced industry veteran in the identity and security market. Tom is also a board member of the Alliance and currently chairs the Identity Council. Joining Tom today, we have Jeffrey Fountaine, who is Director of Healthcare at Ingenico Group and an experienced business development professional with leading health information technology providers. Next, we'll have Judy Keator, who is Director of Sales and Business Development at SecurKey Technologies, a leading provider of identity management technologies and services both in the US and Canada. And concluding, we'll have Jerry Kane, who is Senior Program Manager for SEPTA, the Southeast Pennsylvania Transportation Agency, and he's responsible for fair policy and payments. Jerry is also the chair of the Secure Technology Alliance Transportation Council. So if we could move to the next slide, please. For those of you who are joining the webinar today and who are not familiar with the Secure Technology Alliance, we're a non-for-profit multi-industry association working to stimulate the understanding, adoption, and widespread application of secure solutions. Prior to our recent name change, we were the Smart Card Alliance, but we've now broadened our mission to cover an additional array of security solutions. The Alliance provides a collaborative, member-driven environment to perform education and information awareness about how smart cards and embedded chip technology and other related hardware and software can be adopted across the markets today. As you can see on the right side, the focus of our organization cuts across many different technologies and vertical markets. Today, as a matter of fact, our webinar is going to be touching on a number of these focused areas, including authentication, healthcare, identity management, mobile, payments, as well as transportation. And as an organization, some of the services that we provide include bringing together the stakeholders to effectively collaborate and promote secure solution technology in addressing industry challenges. And we do so by publishing white papers, webinars like today, workshops, newsletters, position papers, and other web content for consumption by the industry. We also run conferences and events to focus on specific markets and technology and offer education programs, training, and certifications to improve the professional development of the workers in our industry. As part of the organization, we provide networking opportunities for professionals to share their idea and knowledge, and we produce some strong industry communications through our public relations resources, website, and social media to communicate our messages out to a broader audience. If we can go to the next slide. I'd like to focus more specifically on one of those industry work groups that's sponsoring today's webinar. That is the Identity Council. And the Identity Council serves as a focal point for the Alliance's identity and identity-related efforts, leveraging embedded chip technology and privacy and security-enhancing software. The right side box there shows some of the council resources that this organization has published and contributed to the market in recent years. And as you can see by the breadth and depth of the topics that are covered there, we provide a broad view of how identity and identity technologies work together in a changing digital economy. So if we could move to the next slide, I'm going to hand over to Tom Lockwood, who's going to give us a brief update on the mobile identity landscape assessment. And I'll return at the end when we go through the question and answer session. So Tom?
Thank you, Randy. Good afternoon. Thank you very much for joining us. We know that there's a lot of competition for your time. We appreciate your investment in today's discussion. Next slide. When we started the discussion of identity, many of us thought of identity being monolithic and tied to a product, a driver's license, a birth certificate, a employee credential. Well, that's really changing. Now we're talking about identity being broken up to smaller pieces, and identity has really moved into become a horizontal element, cutting across all of the different segments and markets. So some of the trends that we're seeing right now, I just want to go through what's happening because there's multiple events happening within the identity area at once. So many people started experiencing services through in-person transactions, and then later on through desktop, then mobile and kiosk and machines. This is blending to become much more complementary rather than in competition. So around people's preferences, quality of life, quality of service, what they're doing is they're really looking at maybe don't want to go in person. Maybe what I really want to do is use a machine, whether that's an ATM or whether that's doing banking from home. But what we see within this blending that's occurring is it's really a choice and a preference. And the other piece of this is that mobile and kiosks certainly are expanding, and that's part of the focus of the council. Certainly privacy is a huge issue. It will become more so as more public and private information becomes available. For identity proofing, there's significant changes for in-person proofing, whereas people used to attend in person or have to go to an area in person. That's all changing now. As we're looking at the back end, it's becoming much more automated. We're applying machine learning, and that's another piece that we need to consider and understand as we go forward. Biometrics are certainly changing. Now what we're seeing is a shift in multiple biometrics being used. For example, in the near future, you're going to see products from Google that combine, say, for example, images with voice or images with other objects. As we walk through, we see distributed ledger technology. We see a blurring between physical and digital securities. So as we start to look at items like continuous data monitoring, as we start walking through and seeing things like non-person entities, NPEs, those identities, when we start thinking about smart cities and internet security of things, we also see when we talk to our partners over in Document Security Alliance that really we're starting to see much more digital identity and identifiers moving into physical documents, like we will continue to use driver's licenses and passports. But you're already seeing the integration of chips. As we continue to walk through, again, zero trust models that are occurring, and again, modularization of identity services, where people are looking at pieces of things that used to be bundled. So again, we're looking for things that are tangible, that are real market-based, and again, things that can make a difference. We're not really looking at academic work. Next slide, please. The problem that we're faced with in the mobile space is a number of inconsistent approaches. It's the Wild West. So one of the things we're looking at is how do we become much more consistent? How do we provide more consistency both in expectations and design build, and again, better user experience? Again, the resources we have available is our community at large. and not only for the Alliance members, but all of the other parts of our communities, the different associations, and again, the different groups that are out there. The target audience, again, is everyone from the ID community in general to those that are really relying parties and consuming those products and services. As we look through, again, our goals are a much better experience, providing best practices, providing content to SDOs. Next slide, please. So our approach, it's a broad overview. What we wanted to take is a collaborative approach where we're dealing with other communities. Instead of dealing with one organizational perspective, how do we deal with different councils within the Alliance, different associations that really are leaders for a particular area? And you'll see that in today's discussions. We want to really leverage the opportunity of community-led, community-identified use cases. So if the Airports Association says this is their priority goal, the Transportation Council or the Health Council, again, this is the perspective from seasoned veterans that are working in those communities to see what's the goal or the trend. As we continue to walk through, we tried to use common templates to make it simple to convey information so that we could really understand at the end of the day, what are the key trends? Where is there convergence? Where there's conflicts? Where there's synergies? Where there's some gaps? So through today's webinar, what we ask you to do is to consider what you see today. If you'd like to participate, if you have additional questions, please feel free to come back to any of the presenters here. If you'd like to participate, we welcome you on board. Next slide. This is the third of the webinar series, and webinar number 1. We started really off with an in-person proofing. In one case, it would be through AMVA. Again, these are all the DMVs across the United States and Canada of how they would do in-person proofing and create a mobile driver's license. The other piece of this is the derived credential being looked at the federal government. This is a high assurance architecture. So we have 2 different architectural approaches. In webinar 2, what we said is now that you have a trusted identity, how is that being consumed for physical and logical applications? In webinar 3 today, what we start looking at is different community use cases, okay? And you'll see that there's different challenges, different priorities as we walk through the communities. Webinar 4 will really look at mobile devices as enablers, and then webinar 5 will tie it back into the back-end integration, okay? So we're gonna start from the beginning and end it with the back end. So we encourage you to think and participate within the other webinars. Next slide, please. With that, I want to thank you all, and again, appreciate your time, and I hand it over to Jeff. Jeff?
Thanks, Tom. Let me begin by thanking everyone on the call for joining us today. I'm going to take the next few minutes to talk about a use case with real potential in the healthcare market. So patient identity has really been a much discussed topic in healthcare, particularly in the last several years, as a vast majority of hospitals and healthcare providers moved to electronic medical records. In fact, just a few years back, Chime, which is an organization made up of healthcare CIOs, listed it as a top priority. And they sought to identify some unique solutions in the market through a challenge. And also many third-party consulting organizations have listed patient identity as an ongoing top concern for healthcare CIOs. And it isn't just healthcare CIOs, it also is an issue within our federal government, specifically Medicare. And they certainly recognize that significant fraud is occurring every day as a result of improper patient identity. In fact, just last week, the government took the first step toward potentially solving the Medicare identity issues, with Congress passing House Resolution 6690, a bill that's entitled Fighting Fraud to Protect Care for Seniors. This bill is designed really to solve for the more than $60 billion in estimated fraud that occurs in the system as a result of identity issues. It's really a monumental first step, and those of us that are in the healthcare industry are really excited about the future opportunity that this bill represents. We certainly hope that the Senate will pass the bill and present it to the President for signature in the next few months. So before I really dig into some of the detail, I'd like to take a brief poll of the audience to stimulate your thinking around patient identity. So Kathy, let's move to the poll. So the poll question really asks you, what kind of identity form would you prefer to use in a healthcare setting? And there's multiple options here from which to select from. So we're going to give you a few seconds to make a choice, and we'll come right back to you. Well, thanks to everyone who answered the poll question. Really some interesting feedback there. So now let's move to the next slide, Kathy. So let's take just a couple minutes, to frame out the patient identity challenge that's really facing healthcare providers. And I always like to start by challenging you to really start to think about this issue and think about it in the context of your last healthcare experience. So what was the identity process like? How was that particular experience for you? Were you confident that all the information was gathered correctly and correctly correlated to your patient record? Fortunately, or maybe unfortunately, I had a healthcare experience just this past week in a Dallas area hospital. My mom was having a routine scheduled procedure, which really allowed me to see firsthand the identity experience. And truthfully, I came away just as troubled as I had been before, and it really reinforced some of the challenges that I've experienced and noted. So let's talk a little bit about those challenges. Well, I personally would really advocate that it boils down to one simple matter, and that's that you are who you say you are, and the provider knows it. So think about that statement for a second. You are who you say you are, and the provider knows it. So how do healthcare providers really know? How do they authenticate that identity? How do they ensure the medical record they are referencing is really your medical record? How do they capture proper payment for services based on the identity information they collect? These are just a sampling of the difficult questions facing healthcare providers as it relates to identity. Next slide, please. So in the previous slide, we showed you an image that was depicting James Smith and Sarah Rodriguez. This is a very real-world example of the identity challenge. So consider for a second duplicate records in the context of James Smith. A patient registrar may have hundreds of records associated with a James Smith, which is, a very common name. But it's also James Smith has previously presented himself as Jim Smith, maybe Jimmy Smith, possibly James Allen Smith, possibly James A. Smith, et cetera, et cetera. This is the very real problem for healthcare providers. And then if you extrapolate that problem across multiple points of care, right? So think about physician practices, specialists, ER, inpatient admissions, outpatient admissions, health systems with many hospitals in a geographic location, on and on and on, right? So if you can visualize James Smith in that context, you start to get a feel for the problem. And this has a real impact to healthcare providers from multiple perspectives. First, and I argue most important, patient safety can be compromised. Having a complete record, or what I refer to as a single source of truth about James Smith and his healthcare, may mean knowing the difference between a drug with an allergy for James and one without. It may mean the difference of having a lab result that exposed certain issues from a previous visit. very real impacts on the patient. Second, it's about capturing the patient's financial responsibility. And that's really dependent upon having the right record and the correct information about the identity. I mean, let's face it, right? Healthcare providers need to be compensated for the services they provide, and they need access to the right information to properly collect. And medical identity theft is certainly another real issue, and it faces the provider as well as faces the patient. Breaches will expose medical information, certainly private identity information, and that's creating real issues. Providers can fix the breach. Providers may pay a fine, but patients oftentimes can be in the dark about how their identity is being used tomorrow, the next day, by these thieves. And then finally, I've already spoken about House Resolution 6690 and the government's recognition that fraud in the system occurs each and every day, and it's costing all of us as taxpayers. So I will say, myself and others in the industry, we really look forward to the day where a system and a process can be built to solve for many of these challenges. Next slide. So now I briefly want to cover what is being said and done to potentially fix the issue. So in this slide, I'm showing how the Office of National Coordination, or the ONC, which is a federal government entity, has looked at solving for the patient identity problem at a high level. So on the next slide, I will give you an example use case for how one company is addressing the challenge. But here I wanted to show how the ONC has laid out a framework as a means to demonstrate an approach or a system, a set of processes for identifying a patient, proofing that identity, and then really enabling the patient to control their identity wherever it is they seek care. And so a couple of key points I'd like to share. So first, the concept of proofing that identity is truly critical. It needs to be done at a deterministic level. This gets back to the idea that you are who you say you are, and that can be determined through a systematic process. Second, that a set of credentials could be established, right? So a set of potential tokens could be established, allowing you to authenticate your identity with each future visit, or potentially to authorize the release of information about your healthcare. Next slide, please. So certainly there's different types of solutions that are available in the market today. And quite frankly, I would expect more to come to the market in the near future. But I wanted to share an example from a company that has commercialized and deployed a strong patient identity offering. And so Amy by LifeMedID really does solve for many of the challenges that I've already talked about facing healthcare providers. And it does so in such a way that a healthcare provider can accept multiple forms of identity, including mobile, and then subsequently allow the authentication process once the patient has been proved. And so let me dig in a bit more there. Next slide, please. So I mentioned mobile, and I want to take just a minute to talk a bit more about that and really talk about how an identity can be generated, how it can be displayed, received, authenticated. If we think back to that poll question, one of the options was a mobile wallet, whereby a patient could leverage their smartphone to complete a registration process, really in any healthcare provider. That's a visionary statement, right? But let's remember, that wasn't the only option in the poll. And this is really hugely critical from a healthcare perspective. Identity shouldn't solely rely on just one form. Mobile really cannot be the only way. From my perspective, patients will have different types of preferences. They simply might lack technology. And I hate to go back to my mom as an example, but my mom is not an owner of a smartphone. So if she was presenting to a hospital with her identity, she would want to do so in a different way. And so we really think that we need to solve for the challenge using multiple forms. It might be smart cards, there may be biometrics, mobile wallets, and I'm certain there's probably a few that I haven't even given thought of yet. But I think the most important thing is just to be cognizant of the entire healthcare market, from elderly patients to millennials to parents of children. There's so many different types of people in so many different ways that they may want to self-identify. Mobile may certainly be a leading way, right, to deploy smart identity technology, but it's got to be coupled with other forms in order to permeate the market and really solve for these increasing challenges we face as patients and healthcare providers face in the process of delivering care. So I want to thank you for the time. Thank you for the opportunity to cover this vertical use case. And now I'd like to introduce our next speaker, Judy Keator, who will talk about the banking industry and its use case. Judy?
Judy, you may be on mute because we can't hear your volume. Judy?
Hi, sorry, I think I saw a problem. Sorry about that. Okay, you can go to the next slide. Okay, so banks have been facing some big challenges for many years now. People around the world certainly are expecting to be able to access services digitally. With growing competition, increased fraud, and consumer trust issues, the banks have been looking for ways to solve these challenges. Payment transactions and the way consumers do business are evolving, and banks are looking for more ways to better serve their customers as well as acquire new customers digitally. Today, I'm going to talk a little bit about the challenges facing the industry and a new digital identity network that's launching in Canada called Verified Me with the banks at the center. I'll also talk about some of the initial and future use cases financial institutions and others are exploring. Next slide. In Canada, the bank started with authentication. A big challenge for many organizations, including the Canadian federal government, was authenticating citizens that need access to government services. Since citizens tend to only log on once or twice a year for these services, username and password fatigue is extremely high. In partnership with SecurKey, the concierge service was launched with the Canadian federal government. So when a Canadian citizen wishes to get government services online, they now have an option to use a government ID or utilize their existing bank logon to access services through a federated model. The service grew tremendously and currently has millions of users and all the major banks participating. However, even though authentication is a great way to add value, the challenge of onboarding and verifying a customer is who they say they are before you can grant access still remained a challenge not only with government services, but even within the banks wishing to provide services to their own customers. Next slide. So after the success of concierge, the banks invested in SecurKey to develop a digital identity network aimed at solving many of these challenges. Next slide. The banks saw a way to play a big role in solving these challenges by working with an ecosystem of partners that could work together to reduce customer friction and fraud. They see an opportunity to leverage an ecosystem for all to provide the unique data and capabilities each organization has about its customers while putting the consumer in control. Not one organization can solve the identity challenge. Next slide. They believe the ecosystem will help close the gaps and add value to their customers. By removing barriers to account opening, offering customer service with less friction, and allowing consumers to leverage the assets the bank already has about them in a wide range of use cases, they see it as a win-win. Next slide. At top of mind during the development of the ecosystem were concerns around how to meet privacy and regulatory requirements. Some of the key requirements for the network needed to include resiliency against denial of service attacks, no added honeypots of data, the system shouldn't store any identity information, puts the user back in control to see what information is being requested with a strong consent model throughout, triple blind privacy, so data providers and data consumers are blinded from each other and the broker cannot observe the data, and it should be built on industry standards and to meet regulatory requirements. Next slide. In order to help solve the identity challenge, you need high assurance by combining multiple factors and ID claims to include what I know, what I have, and what I am, while putting the consumer in control of their own identity. The consumer will now have the ability to share what, when, and where they want. With the banks at the core of the system, there is already an established trust with consumers. The banks see the ecosystem as a way to leverage the power and capabilities that multiple asset providers have about a consumer, putting the consumer in the middle. A consumer now has the ability to utilize these assets to more easily conduct transactions online, and providers will have stronger assurance in verifying identity. Banks can get much stronger identity validation through other assertions such as device information from a telco, credit information, background checks, government ID, biometric verification, and others as more providers are added into the network. The consumer can now provide all the information requested during a transaction and complete payment in one easy, frictionless way through their mobile app or on the web. Next slide. In Canada, the banks are the identity anchor into the network. A consumer will set up their verified me profile by first obtaining their digital assets from their bank. Additional assets can then be obtained from various other providers and cross-verification achieved. The consumer can utilize these assets for a wide range of online transactions, and the bank can provide data assets and payment for a seamless transaction. For example, a consumer can verify their identity and complete payment when renting an apartment, opening a telco account, buying or renting a car, conducting government services online, retail purchases, and many other use cases. The power of the ecosystem and use cases are endless. Next slide. The banks also wish to be a consumer of the service for stronger identity verification for use cases such as online account opening, loans and credit card approval, self-service onboarding, and call center integration. They see the network as a way to improve the onboarding experience for account opening and across product lines, enable self-service and shift to automated channels, leverage data from other partners to provide better customer offerings, and leverage assets they already have and obtain ones they don't. In the following, I'll cover a couple of use cases from a financial institution perspective. Next slide. So this next demo is an example of a credit card sign-up. At this time, it can be difficult and an expensive process. Currently, there's high drop-off rates for existing ID verification methods. I don't know about you, but I can never seem to pass my own KYC test. That seems to be the root of how we're getting verified online. So having the ability to leverage the network helps to streamline and reduce costs for the bank and provides a much simpler process for the consumer. So this example is going to show a transaction through a PC, but it could also be on a mobile device. So Kathy, if you want to go ahead and click the link. Okay, so again, this would be an example of somebody on a PC. They're going to apply for a card. Now, in this instance, they're going to have the option whether or not they want to do it the old-fashioned way or they would open up an account with Verified Me. So have you click on that link. And if somebody already has a Verified Me profile, this process actually could go much quicker than we're going to step through here. Because if you have a Verified Me profile, the consumer can actually just scan a QR code and all of the data will get passed automatically. In this instance, we're going to assume they don't have one. So they'll click on the Verified Me app link. They're going to get brought to authenticate with their existing bank. Click on that. And here's where they'll sign in with their existing credentials. And this will establish their Verified Me profile with their basic bank information. For this particular transaction now, the user needs to also provide their credit profile, so they'll click to agree to the terms and conditions and then click continue, which will then pass the data to their credit agency for cross-verification, and they'll just agree to get their credit profile into their Verified Me app, click continue, and at any time then they'll also be able to review the information. So if you click on review for credit profile, you can actually see the data that's passed back, confirm it, and again there's strong consent throughout, so then the user will authorize and the application will actually be complete. So that's just an example of the PC experience for a credit card sign up. If we go to the next slide. This next use case is from another financial institution, Sun Life. Sun Life immediately saw the benefit of the service to help solve some of their challenges and provide benefit into the network. Sun Life would like to better serve their customers through self-serve channels, which is currently a difficult process. They wish to make the online portal registration easier, reduce the cost within their call center, and eliminate password resets. So on the next slide, there's just a short video. So Kathy, if you want to go to the next slide. And you can click on the video. So this demo shows the self-serve registration flow using Verified Me, which previously this process could take up to 7 days. So within the Sun Life app, which in this instance is just coined Moonlife here, a user will now have a choice to use Verified Me to sign up or still sign in manually. So on the next screen, you'll see Sun Life also had a request for phone verification in addition to the base bank profile in order to link their account. So the user's phone number and SIM against the device is being verified. The information is verified at Sun Life and their account is linked, and the user now has access to the portal. If you go to the next slide. So this is just an example now, the last one, of showing a call center integration. So a major theme we hear from many organizations is around how to verify the identity of the person on the other end. The process can be frustrating for the consumer and call center agent, getting asked many of these questions when they first call in and then all through the process, even once they get the agent online. So this demo illustrates using your Verified Me profile when calling into a call center. A user calls into the call center and is asked to enter their mobile number. A link is sent to the user. The user clicks the link that initiates Verified Me, and the user can start the process. They authenticate with their bank and can now use Verified Me to send their information to the call center. Within the app, they can review the information that will be shared with the call center. Then the user can consent and share. The data will be received by the call center and can be integrated into the call center software, so it can automatically pull up the caller's information and any previous records. So hopefully now the user no longer has to have a lengthy verification process before the call and once they reach the call center agent. So the next slide. So just in summary, financial institutions are very keen to utilize the ecosystem as an asset provider and consumer for the entire customer lifecycle, starting with onboarding, account registration, self-service, authentication, payment transaction verification, and account maintenance. Thank you. And I'll now turn it over to Jerry Kane from SEPTA.
Thanks very much. Hello, everyone. Thanks for joining the webinar. Transportation is another sector which many opportunities are there for mobile. It's really to employ mobile together with traditional roles of payment and travel planning. Public transit specifically is well positioned to layer on mobile ID in view of the many contactless ticketing systems in operation, which are based on near-field communication, the standards-based proximity technology, which in principle is compatible with a growing number of smartphones. So I'll show how NFC and mobile ID could layer on into the transportation sector, or show a few use cases, how it looks across a metropolitan area or a city, and then present some challenges on how that could be implemented. We do have a poll question I would like to put up, if we could do that. So in the US and many other countries, transportation is divided among many different levels. And I was just curious where you see organizations leading the way for mobile ID in transportation. So we'll take a minute for that to come in. Interesting. My own feeling, and there's no right answer to this, obviously, but I believe public-private partnerships and smart cities might be the leading areas for this type of initiative. It's not completely highly visible right now in transit, but I do see these areas as being on the leading edge of how mobile ID might get implemented. Next slide. So what is the value of mobile identity in public transit? You know, it can enable operators to become more efficient by changing the traditional way fare media is issued and how credentials are stored and retrieved when presenting fare media for travel. Also, NFC-enabled mobile ID could require strong identification to prevent misuse and digital fraud and reduce the level of fraud from currently issued traditional ID cards and media. Could also link the rider's ID to an agency's fare tariff and apply the appropriate rate based on the rider's traits, age, and social service needs. Most transit agencies are challenged to issue and manage special needs fare media, including students, retirees, seniors, and disabled, and many other programs, corporate tax being one of them. All of these have a costly and time-consuming burden for issuing media. My own agency in Philadelphia is still issuing a contactless senior card. I think we're up to about 100,000 individuals who now had to be processed to get a picture senior ID contactless card. Next slide. So transit operators in major cities operate many types of electronic ticketing. Systems with complex systems are moving to NFC contactless, barcode payments, and more recently, mobile wallets. Although most agencies issue an agency card, mobile phones are seen as a much more robust way of performing a variety of travel-related options in addition to fare payment. The industry is also moving toward an open payment platform with the acceptance of bank-issued contactless cards. So in this context, mobile identity serves, I think, as a logical progression to link an account to enable riders to access prices, schedules, and mapping, and really to plan, book, and pay for travel. The industry has about 6,700 agencies in the US with about 10 billion in revenue. A lot of that revenue is paid in cash. So agencies are looking at the new technology really to reduce the cash burden and make as many transactions as possible electronic. Next slide. So for use cases, we can look at riders who qualify for certain benefits or discounts that traditionally require registration at an agency's office or online application. With mobile ID, operators' online platform could read personal data from a contactless electronic identity. Conversely, the rider could download a mobile application to a mobile device, and here the customer's new account could be activated right away instead of the time-consuming process we have today. So for someone that's qualified for pre-tax benefits, they could bypass the traditional way of doing this and use their phone for tapping and riding. A seamless approach could use a primary identity that interfaces with an NFC-enabled phone. And there'd be no need for agency cross-check before activating the account because it's a known identity. Next slide. So here I see Mobile Identity joining a pool of other NFC platforms to help us with this. Identity management really becomes part of building the NFC platform in order to realize seamless travel in a city or metropolitan area. Today, travelers must navigate travel services separately and without the ability to coordinate payment, transfers, and wayfinding. A patron that has an NFC card to ride transit, for example, would also need a credential for bike sharing. You may have that ID for the bike sharing, but there's no way to pay for that part of the trip. So what we've really built in cities and metropolitan areas are really a series of stovepipes where it's all individual, kind of a la carte for how you pay, book, and travel for planning. I see identity management as another tool to overcome the non-seamlessness that we navigate in cities, and really furthers the goal of multi-payments as you go to a city or metropolitan area. Next slide, please. So, of course, building and operating a mobile platform like this with mobile identity and coordinating many travel services faces a number of steep challenges. Unlike large payment brands, there's not a unifying framework to provide back-office integration of the key stakeholders and data management systems to unify the underlying accounts. In addition, a unified platform requires coordination among many operators, and there may be competition for information and data generated. And finally, systems integration faces complex legacy technologies along with data security and an overall lack of industry standards. So certainly, in summing up, the concept of mobile device to meet the legal and technical requirements of linking identity with travel is a great opportunity if the solutions can deliver an integrated payment system along with field performance required by travelers. So thanks very much for joining the webinar. That concludes my remarks. I think I'm going to hand it back to Randy now.
Yes, Jerry, thank you very much. Also, thank you Judy and Jeff for your great presentations today. We've got a few more minutes before we end today's webinar to take some questions. Folks have been submitting questions online, but if you haven't submitted a question yet, please do so now. The first question, I'm going to go back to Jeff Fountaine on the healthcare use case. And the question is, doesn't HIPAA provide standards to protect patient identity information?
You know, generally speaking, it certainly does. However, I think the application of it is the area of concern, particularly when we think about breaches and the medical information that's exposed in those breaches. So there's a motivation, I think, on behalf of healthcare providers to follow HIPAA standards. I think where we're looking to solve for the challenges I discussed are in how we really secure that identity and limit the potential impact, but also furthermore kind of give more control to the patient than I think they currently have today.
Thanks, Jeff. There's another question for you. Is there a trend to centrally locate electronic health records?
You know, trend, I'm not sure that would be the right word. You know, I'll say this, when we think about centrally locating the EHR, that's certainly happening at a system level. So what I mean by that is a health system. There's companies out there that are helping hospitals consolidate their infrastructure and locate that medical information centrally. I think what the challenge is the word interoperability. So the ability for the different EHR systems to speak to one another, to share meaningful data, allow patients to access that meaningful data, and then to share that meaningful data with their respective providers that they choose to visit. So I think the real issue or trend in healthcare is how do we solve for the interoperability challenges that are present in what I call a capitalistic market.
Thank you, Jeff. This next question is for Judy with regard to the banking use case. What is the industry doing to weed out artificial or synthetic identities so that these fake identities don't spread to uses in accessing non-bank services?
Sure, I think that, as far as the ecosystem goes, there's already established identity with the existing partners. The partners are sharing the identity information, with the consent of the user. So there's a level of cross-verification that's taking place. And so, there's a lot of discussion within the network on the governance of that and how to prevent that from coming about. But really the power of it is that you're already utilizing existing credentials.
Okay. Another question for you, Judy. You spoke about the Canadian experience. Are any banks looking at cross-border initiatives using Verified by Me?
Yeah, actually, as a matter of fact, there's been a POC, and I believe some of the findings on that will be published shortly. Obviously, crossing borders has a number of challenges with different regulations in various countries, but there is strong interest in enabling, that ability to open accounts and digitally across borders, right? So, there's a number of use cases where an individual may need a bank account in another country, such as, if they're purchasing real estate as an example, or have a child attending college overseas. So, the ecosystem approach is helping to bridge those gaps, and I think some of the banks are, certainly looking to test that out. And then there's also initiatives even with a digital network, within the U.S. And other locations.
Okay. Here's another question for you regarding the bank use case, Judy. Should authentication be monetized, or is it truly a function necessary to protect the citizen from the actions of criminals or bad people?
So I think that there's authentication and there's identity verification, right? So I'm not sure exactly if the question is focused solely on authentication or the identity verification, right? But, I think that certainly the thought around the network is that it will not be a strong barrier. It will be a free, item for a consumer needing to use the service. And then for people that want to consume the data, they would pay to be able to get that strong identity verification. And then you're utilizing, existing authentication channels that already exist within the bank.
Thank you. This question is for Jerry, our third use case around transportation. Why would I, as a user, want to turn over my personal information to a transit operator? What benefit is there to me?
I think that really dwells within the convenience factor, and will take, many non-traditional rider cases. Either you qualify for, a dial-a-ride service, or you're a senior citizen, and today the application process is a little bit cumbersome. But if you're using if you're using an electronic ID to transfer that application to the authority, you're not really compromising anything you've already set that already. So I see it as more for a convenience factor. You would not necessarily have to do that if you choose to not use the electronic way of doing that. And it may not be the transit authority that's accepting that credential. It could be a third party that's coordinating a range of services within a metropolitan area. And I think we're probably not as advanced as an industry as banking and healthcare. I think mobile identity is kind of still making its way through on another way to act as a credential to ride and travel. Yeah, I think it could be one or the other. If you didn't choose to do that, you would still be qualified to take the service.
Great. And I think we have time for one more question. And for you again, Jerry, what are your thoughts about using a state-based mobile identity solution, perhaps a mobile driver's license, for a city transportation service?
Yeah, that I see, and I know there's a number of states that are out front in the U.S. with that, but to me that would be the anchor for any type of mobile identity solution, because I'm not really familiar with other electronic forms of identification that a transit agency or a service provider could leverage in order to make that into the suite of fare media types that could be used to travel. So I'm hopeful. I think that these few states, I think there's a handful of states in the country right now, Iowa, Colorado, Idaho, Maryland, and a few others that are making this initiative. So they're really the cornerstone for how electronic ID would be leveraged, maybe in the transit or the non-auto driving space.
Excellent. Well, thank you very much, all of you, for their presentations and your responses to the questions that we received today. If we could go to the next slide, just before I let you folks go for the day, there is a number of resources available if you're interested in this topic around identity that the Secure Technology Alliance has available, in addition to the previous webinar that Tom mentioned at the top of the session. The Secure Technology Alliance Knowledge Center has a large number of documents that are available for free to participate in this. Also wanted to make you aware of a conference that's going to be held in the Washington, D.C. area on December 4th and 5th called Securing Digital ID 2018. And at that event, we're going to break down some of the real difficulties associated with identity proofing and authentication, and then look at how some of the current technologies on the market are responding to both the strengths as well as some of the weaknesses that will be discussed in the current state of digital identity in the U.S. The last slide is the contact information for all of us who participated as presenters today. If you have any follow-up questions, you can send them directly to any one of these team members, and they'd be happy to help you with getting answers to those questions, or you could send them to info@Secure Technology Alliance or securetechalliance.org, and we can get those answered by other members of the Secure Technology Alliance if it's different from the people that were part of today's webinar. Also remember that this webinar has been recorded, and it will be made available to you as well as the presentations shortly. So please look out for an email communication from Secure Technology Alliance with that link. And I want to thank you all for your participation today. We certainly enjoyed having you, and thank you panelists for contributing your time and knowledge to help address this very important issue. Enjoy the rest of your day. Thank you.
Take care, everybody.